This is how you know it's live, because it was right there. Welcome, everyone, to Real People, Real Talk with Meridian Psychotherapy Services. I am not your host, but I am on camera with you. I'm Salo Ortiz, one of the facilitators here at Meridian Psychotherapy Services, and we are hosting Real People, Real Talk. It's I like to say a laid-back hour-and-a-half conversation about real topics that aren't often addressed in the community when we talk about mental health and substance use. And so we've taken different topics like opiate addiction, mental health treatment, and now sex addiction tonight. This is so important. And so I just want to thank everybody for being here and thank everybody for tuning in, because I think that we have to do this line of work, this part of the work, some real justice and some real respect to the work that you guys do. So I appreciate everybody being here. If you're just joining us for Real People, Real Talk for the first time, we are recording. If you want your cameras off, you can turn your cameras off. That'll be fine. But we will be uploading this on YouTube for future reference so you can share it with everyone. We know that you will give this topic the respect that it deserves. But the rules are simple. Speak from your heart. Speak from your heart, speak freely, and speak honestly, because we want people to have a real representation of the work that you do when it comes to this area. If you have questions, I encourage you to save them towards the end. We'll save questions as much as possible towards the end, the last 20 minutes or so, John. Okay. We'll take questions. But if you have a question and you've got to get it out because you just can't seem to bite your tongue and your meds are wearing off, then please jump in. We won't be able to really monitor the chat as much because we don't have as many people working this, but I do encourage questions. And all I say is just let's have a real conversation. So thank you everybody for joining in. That's all the time I'm going to take. So you're going to see me sneak around back, and your moderator John is here, so I'll introduce him.
Hello, I am John Wren. I'm a intern. Well, between intern and licensure here at Meridian Psychotherapy. Just finished my master's degree in May, and really want to thank the panel for being here. This, as Salo said, this is a hugely important topic, and I think a very misunderstood topic from the standpoint of, I think when people hear sex addiction, they're not really sure what to think about it. Most people don't know how to relate to it. So I'm hopeful that by having a panel that consists of a clinician, a partner of a sex addict, and a sex addict, that we can give a broad coverage to the subject and gain some perspectives, hopefully, between maybe across those three genres, having the viewpoint of all three of them in the same room at the same time, I think can add some richness to the discussion. And Patty, do you have anything you want to? Okay. And so to kick things off, I just want to take an opportunity to give each of the panelists the chance to introduce themselves. Brief history, as much as you feel comfortable sharing, about your experiences with sex addiction, and then we'll move on from there. So, Jeanette, do you want to lead off, or?
No, I prefer.
Okay, that is fine.
I mean, since we're talking about sex ed.
Yes, that's okay. Well, okay, we'll leave it to, we'll let the clinicians start off and let Dr. Bowen.
Sure. Well, thank you very much for inviting me. This is important, as you all said, a very important topic. Just a few days ago, I ran into an old friend who's a doctor, and he said, well, as I recently retired, he said, what were you doing? I said, I was working in addiction treatment, sex addiction. Sex addiction? What's that? I said, do you read the newspaper? Yeah. So of course, we're talking about a certain extreme. We see illegal activity, things like that, on in the newspaper. What happened to me though? I was working in addiction treatment, and this was in 1991. And I had a patient who came who had been. What happened was he was a man who was caught up in a fetish, And his wife came with him to the meeting, and they didn't come necessarily because sex addiction, because they thought that maybe he had some other kind of addiction. But anyway, she found it to be quite disgusting and upsetting. But something which we actually started in childhood for him. And so at the time, a year before, I went to the American Society of Addiction Medicine annual conference, and there I saw the book called The Sexual Addiction. And I picked that up. This was 1988. And so I read it, but didn't really act on it until this patient came. And then when he came, then I contacted Dr. Carnes, who wrote the book. And so he said he was doing a program out at the University of Minnesota. Why don't I come on out? So I went out there and met his staff, and at the Golden Valley Hospital also went over to the University of Minnesota and worked there too. So then he developed a program for certification in sexual addiction therapy. And so I took that course, and I became very involved in the what's called the national organization called Society for Advancement of Sexual Health. And that's a worldwide organization. And in fact, in 2028, Patty Smith and I made presentations at that conference. We happen to have it here in Virginia Beach. But in my practice here at Meridian, we started with groups for people with sex addiction, and saw lots of people getting better. It's an illness which is very treatable. And but I'm sorry we haven't really, I don't think, got it through to society how well the illness can be treated and successfully treated. We use the same principles in treating sex addiction that we use for all addiction. You know, we see these commonality. Tolerance, you know, as you become tolerant to drugs, you gradually increase the dose. Dependence is withdrawal. Withdrawal is the hangover you get after acting out, say. So we look at also, I'm going to go on and on, but because there's many different types of sex addiction, but they all have the same commonality with tolerance and dependence. And with the dependence, it gets worse and worse over time. That is, the withdrawal reaction gets worse. It's progressive illness and it's predictable. It will predictably get worse and worse over time. There's no, just say no doesn't work. Because no, Lord knows, I'm sure most everyone, whoever had a problem with sex addiction, said no, and it's been impossible for them to hold to that. No, because the addiction is so captivating, it's so overwhelming. It's a disease of losses, and the losses can affect all departments of one's life. You know, physical, family, emotional, social, occupational, and usually can affect at times, certainly over time, it affects all aspects of one's life. Even to the point of serious depression and suicide, you know, because we've had some patients who have just started the treatment, really never got involved in treatment, and end up killing themselves. So it's a desperation. Now, the desperation that most everyone gets into, hits the point of desperation in their lives. And when they hit that desperation, they don't know it, but that's a gift. The gift of desperation, because there's a lot of paradoxes in it. You know, one of the paradoxes, of course, is with addiction, you act out to feel better, and you end up feeling worse. That's the paradox. And here, paradox. Imagine saying desperation is a gift. Mm-hmm. It's a gift as long as you're able to fall into the welcoming hands of people in SAA and in sex addiction recovery. But I'm going to stop talking there and let others go on.
Okay. Jim, as much as you're comfortable sharing.
Okay.
And so
it's good to be here tonight. I'm just going to go ditto. That'd be the first thing I can say. I am a recovering sex addict. And my bottom line behaviors were masturbation to the point where I hurt myself physically at times, as well as fantasizing and or acting out with children's, teens, or adult women. and started in my home. Ironically enough, this was when the TV actually became real, the black and white. And there was this movie on with a young woman in a bondage situation. And I didn't know what was happening, but I was actually feeling turned on by what I was seeing. And then not too long after that, I just felt something nice below my belt and decided to masturbate. And gee willikers, it felt so good. It really did. And to the point where it became compulsive. And as I said, where eventually I hurt myself a couple of times physically because of that. I grew up in a family that, well, my mom and dad had me ordained when I was born. That's kind of hard to do, especially my mom. And I felt, well, that's like, what I got to be. And so I went through grade school, high school, did very little dating at all. Just an idea. My mother got me my date for the prom, which was very interesting. She was a nice lady. I probably wouldn't have picked her. I kind of hope she doesn't get this. Anyway, I went into the seminary because I figured they could stop my masturbation. That didn't work. No matter how many times I read the confession, it was still there. It didn't go away. And so second year actually in the seminary, I wanted to leave. I wanted to become a state policeman. And I told my mom and dad about it. And they blew up. Well, actually, my mom broke down in tears. My dad was yelling at me. And one thing he said was, they won't accept you in the state police. You wear glasses. I don't know. So anyway, I said, I'll never bring this up again. I never did. So went through the seminary, got ordained, and first parish I was in, first church I was in, I wound up developing a relationship with the family, lovely people, great people, and established a relationship with, they had 2 daughters and a son, and I became infatuated with the little one. She was about 9. That's significant. I can explain a little bit later on. And did I do anything that I thought was serious or problematic? No. Did I feel good about it? Like Dr. Mike is saying, I did. Not too much pain. And then one day I actually returned a little toy figure to this little girl, and she started crying. Dad was there and he exploded and scared the heck out of me. Came back, conversation with the family, never do that again. Didn't, not with her anyway. And there was never anything genital, could have gone there, sure. Some kissing, rubbing tummy, rubbing back kind of deal. And that's pretty much the way it went. And as time went on, that feeling of satisfaction, that rush that I got was starting to get less. And then finally, it was getting to the point where I was starting to feel a lot of pain, emotional pain. And I didn't know what to do. And I wound up talking to my chancellor, and he said, let's give you some help. And so sent me to an internist, gave me some, oh God, it's an antidepressant, starts with an A. I don't know. Anyway, well, I felt good with that. But I was also to the point where I was starting to talk with some people, and I was also, again, feeling, that pain. If it wasn't for the fact that I reached out in pain, I mean, I don't know how else to say it. That's the best way I can say it. I was getting skinny. I was hurting like hell. Suicide was a viable option. I could, I had a vehicle, and there was a place up on Route 81 that I could have gone over the edge. And the only thing that stopped me was if I didn't kill myself, then I'd be a cripple in my own body. So talked to this psychiatrist who referred me to a clinical psychologist, who then I went back to see the chancellor, and he said, the bishop wants you to take another assignment. I said, I can't and I won't. That may have been the second best decision I ever made in my life. The first one was to go back to school. And because once I was told I was not smart enough to do college work. I've got a master's in counseling psychology now, which I am so grateful for. Anyway, I went into treatment. That saved my life. And that idea of learning to become more honest versus denial. I was scared enough, definitely in pain enough. And then right before I went into treatment, one of my friends said, boy, you've got I give you a lot of credit for the courage you have to go and get some help for yourself. And I didn't say this to him. Of course I did. Us addicts just keep everything in here. Why not? It'll eventually, it would kill me, but take it far enough. Anyway, my mind just went blank. So I thought to myself, what the hell could be wrong with me? I should be out of that place in about 6 weeks. 7.5 months later, when I left this treatment center, it did save my life. We would not be sitting here. I would not be sitting here talking with you if it wasn't for St. Luke's in DC. Anyway, I went back to ministry where I got my master's. Then I took a leave of absence. And by that time, my mama died. And my dad actually had a stroke. I was allowed to go home. I wasn't treatment, but I was allowed to go home and visit him. And the first thing out of his mouth was, Jim, do whatever you want to do with your life. I resonate with that today. It touches me a lot. Anyway, I graduated, took a 2-year leave of absence, decided to get a dispensation from Rome, and decided that I wanted to become certified as a hospital chaplain and an addictions counselor. That I wanted, what's ahead. So, maybe one other part, when I was in treatment, to let you know just how close I was to going into an area that I've seen people go into where I could have been. And that was one day when I talked to the sex addiction expert at St. Luke's, who said to me, Jim, you were at the edge of a cliff, and all you needed is one more step. And he said, you'd have been in a world of pain you can't even imagine. Anyway, I left. I wound up getting a position down here at Holy Family. And I was there until about 4 years ago, when I had to retire because if any of you are familiar, Pennsylvania had this Pennsylvania report came out, and I was one of the people on it. So, yep, could have been in prison right now. By the grace of God and the people, really, it takes a village to raise an addict. And I'm just coming with this right now, and I believe that's true. I couldn't do it by myself. My best efforts got me into treatment. My worst efforts got me into treatment. The best thing that happened was I got to treatment. Anyway, this report came out and I had to retire. And since then, I've been working the land and cleaning houses and really enjoying it. I can't say enough about it. I am sober 35 years from my bottom line behaviors. I didn't think that was possible. No way. But by the grace of God, I'm able to be here tonight. Thank you, John. I didn't think I was going to be too long.
Thank you, Jim.
Thanks for letting me share.
I'll just say that'll teach you to come up to me in Walmart, won't it?
Yes, Walmart. Yes.
Okay, and last, Jeanette.
Yes, I'll speak now.
Okay.
First, I want to say thank you, Jim, for speaking, because I feel very strongly that we need to talk openly about this, and that because it is such a misunderstood addiction, and it usually comes with a whole round of jokes and that it's difficult for people to speak in an open forum. And so thank you for doing that.
You're welcome. Thank you.
And I don't want to, I'm going to speak tonight for myself,
Mhm.
not for the group that I've been a part of. But I will say this about that. All of us are significant others or spouses, and we have been lied to, betrayed, hurt in ways that are probably difficult to imagine. And yet each one of us has a unique experience, but eerily similar. So with that, my spouse, I knew for a very long time something was wrong in our marriage, and that there was not transparency. I didn't know exactly what it was. And when I discovered trunks and closets and locked boxes full of pornography, we had a problem here. And with that discovery came the knowledge of just how long I had been lied to, how many family events that were supposed to be family events but became me and my children, because that was time away from being able to act out. It puts one in the position of wondering what is real in your life, and whether the person that you thought loved you had any feelings about you in a constructive way at all. I did not know that I was being gaslighted. I did not know that a lot of the half-truths he was using to manipulate me were so he would have time to do his thing. And so it takes a toll on who you are as a person. You spend a great deal of your time trying to compromise and just avoid outbursts. And at some point you realize, where am I? I'm not here anymore. And so recovery for me was about reclaiming who I am and who I'm supposed to be. And also for me, humor was something that gave me perspective. My spouse also had an additional mental health issue. So the counselor that we were seeing together was very good at categorizing behavior for me and delineating, well, this is bipolar, this is addictive behavior. And so that was very helpful for me. Also, I established, I had to learn boundaries and what it takes to have realistic boundaries and to enforce them for myself. I didn't really, for me, I let go of his behavior pretty early. I figured that if we were going to stay together as a couple, he had his own issues to deal with. And I knew that I now had issues to deal with where I didn't understand that before. And most of my issues were as a result of the behaviors that I had been dealing with for a long time. So I approached groups. I was very open and eager to go to groups because I saw that as a process of cleaning myself. Many folks in the groups were angry that they had to be there. And so they felt they had to be. And I wanted to be there. And so it is a long process. I established that I would not make a decision for a year as to whether I would stay in the relationship or not. And that there was the understanding that if I decided in the affirmative to stay together, that there had to be significant changes in his behavior. And I made it clear that I had seen a lawyer and I had information. And I did a great deal of reading, and which was very helpful. And so that's my story.
Thank you for sharing that. Janet.
Yes,
I know that's not an easy story to share.
it's much easier now.
Well, that's good. That is good. Any questions here in the room before we start? Because otherwise I will go and hog the questions first. For a part of the recovery from the addiction that I think gets overlooked a lot of times is that interaction. That's why between a sex addict and their significant other, and because it's a co-process. There are parallel processes going on at that point in time, and I think that. As Jeanette shared, having that perspective of knowing you had things you wanted to work on and needed to work on, and stepping back, it can be extremely helpful. But I think that's not a side that that a lot of the sex addicts see, or that maybe a lot of partners see. And so I'm wondering if you could talk a little bit about what helped you to reach, or how did you reach that recognition that I need to just kind of back away and do your own work?
I think it was helpful. It sounds very strange, but my mother-in-law was probably an undiagnosed, was bipolar and was not diagnosed. And in my father-in-law's life, we had responsibility for his end-of-life care. And my mother-in-law was taken to another part of the state. And my father-in-law was so angry. And I don't know how to, anyway, he just was so angry and bitter. And at one point, I said to him, would you like me to go get his wife? And he said, no, she's perfectly fine. I don't want to see her. And I thought, when this really started coming to the fore, I could see that I was headed to that place.
Okay.
And I didn't want to end up there. I came from a family where people were happy. At the end of their lives, they were pleased with the life that they had led. And I just thought that was so sad that he was that bitter and angry and disappointed in the people he loved.
Okay. Thank you. Dr. Bowen, kind of along the same line from a clinical standpoint, you know, what do you see as the important kind of relationship developments that need to happen or can help a couple to, I'm not going to say stay together. I'm going to say reach the point where they both can continue their lives in a happy manner?
Well, Jeanette spoke about her own problems and patience that she had, and observing her husband and family and seeing she obviously very acutely aware of what was going on, very attentive to the issues in the home. And I guess we try to say getting involved in sex addiction treatment, we'd like to meet with the spouse together and let the spouse know this is a treatable illness. If at all possible, somebody who's coming new to treatment, it'd be best for them to go to residential treatment to start off. You were there for 7 months. Most people aren't there quite that long, but some are longer programs. That would really be the best way to start. And part of the these inpatient rehab programs for sex addiction include couples therapy, maybe up to a week perhaps of them being in therapy, and it's a new language. That, like you mentioned, gaslighting. I mean, could you give us an example?
In my case, it was usually something was said to get a reaction from me. It was kind of like you would walk in the room and throw a punch, and I would respond, and it would be like, "Oh, look, see, you're crazy."
You know, Dorothy.
No.
Denial, or I mentioned to you, you relate to it. It's denial, accuse or attack, and reverse victim and offender. So you can relate, right? So this is the terminology related to spousal abuse. You know, where the let's say male is acting out, and then we'll try to reverse, to try to make the spouse look like there's the problem. It's not me, it's just you, yeah. So these dynamics which go on in families with the sex addiction going on, because they've been going on for a while, I'm sure. And those things you have to be made aware of. You have to talk about them. We have to, and the other thing is we can't expect immediate recovery. It's a process. It takes time. You know, you may be able to come and accept that you have a problem, that you're powerless over, you're looking for help, and you start to go to programs. But it takes, your brain doesn't get it like this, it's a process that takes time. And during that time, then we try to hope that the family members will be in therapy as well as the patient. And they'll work together and have couples counseling as well as individual, and maybe both individual counseling, and then the 12-step programs, COSA for family members, codependence and sex addicts, and SAA for sex addicts. But this is a process, and then of course the other thing is once you get in the program, work the program with a sponsor. To have somebody's walk the path before you. I was thinking about this, that, in fact, I have it right here. I'll just get it, just take a second to read it together. This is the book Sex Addicts Anonymous, that comes about. Now, do you know how this book, this book is spiritual? This book is this will be valuable forever. Now you can take a novel, read it, put it away, not this. So I think contained in this book, okay, like just one thing, contained in the book, the promises. You all go to the meeting, you read the promises. And when I first, they're here on page 83 of the A big book. So I remember at first read it. I said, wow, promises, it's crazy. How could they ever think of such a thing, and to say, and listen, number one, we're going to know a new freedom and a new happiness. Number two, we'll not regret the past, nor what to shut the door on it. We're going to learn from it, No matter how far down the scale we've gone, we see our experiences can benefit others. And that's through the 12-step programs. That feeling of uselessness, self-pity will disappear. And I don't know. Did that apply to you, Jim? Did you caught in useless and self-pity?
Oh, I wasn't smart enough to go to school. I wasn't smart enough to do X, Y, and Z. The only thing I could do was be a priest. Carve that out first.
No, that's great. We'll lose interest in selfless things and gain interest in our fellows, because with this sex addiction, it's all insular. You're all down and you focus on one thing, and that's what your acting out behavior is. You're not able to make friends, Self-seeking will slip away. Our whole attitude and outlook upon life will change. Fear of people. Did that apply to you too? Fear of people?
Oh, God bless us. Because of my parents, I came to, I was terrified of anybody got angry or rageful. I would want to run and, well, we have whatever you want.
Mm-hmm. Yeah. So, yeah, I had the same growing up. You talk about your dad. My dad I became a doctor. He was a doctor. I don't think I became a doctor for the right reasons. Fortunately, I quit now. But it wasn't. Now, I think I made the best because I was able to make peace with it and got in my own recovery, 12-step recovery through Narranon and Al-Anon. We'll intuitively know how to handle situations which used to baffle us. We'll suddenly realize God's doing for us what we couldn't do for ourselves. Of course, that's probably the most important. God's doing for us what we couldn't do for ourselves. And so this is turning it over to the higher power. Now, I can ask you about this. Now, you were a priest, and so what different happened to you when you started going to SAA as far as spirituality goes?
Well, first, first I had to go through treatment because I had to find out that the answers were in here, as painful as they were. But if I didn't deal with this stuff, I couldn't go on. It wasn't out there. It wasn't like, well, if you just get straightened out, we'll just be fine. My mother used to have, in fact, the day before I went to treatment, she made the comment, now just remember, Father, there's nothing wrong here. And don't you dare tell anybody. No lie. That's exactly what she said. So it's a process. My spirituality, and I say this in all honesty, it's the 12 steps, not the Catholic Church, that helped me to find that new spirituality. Now I can say that I look at my spirituality as far as my faith walk goes. differently, but it's the 12 steps. And it truly has become my way, it's a way of life for me. And and again, I can preface it by saying, go back 35 years when I got going through and getting out of treatment, I figured, give me 2 years, I'll have this program by the short hairs and I won't need it anymore. That was 35 years ago. Still going.
You haven't finished yet.
Actually, I know.
Well, that's the beauty of it is that you haven't finished yet.
Yes,
We have.
yes. There's always something new in life. Yeah, I appreciate the life problems I have now compared to what I had. Yes.
I would say that, the reason why I stayed initially with my husband is his language changed. He was using repentant language and he never had before.
Wow.
And, so I knew that was a sign and an indication to me that something internally was going on. And I felt, because I also have a theological background,
Oh, okay.
I felt that I had to stay. Because if we were on a road to forgiveness, then I had to see where that road was going to go.
Sure.
And so that was, and we were about a year into SAA and COSA, and one night after a meeting, we were going home. My husband said, you know, I created a lot of drama. Really? Yeah, it was me. I created a lot of drama. And I said, now what made you think that? And he said, well, always thought it was you, but it was me. Okay.
So not only,
Big revelation.
not only did he blame you, but he was convinced.
Yes.
That's how distorted thinking gets, huh?
Yes.
Really far.
Yes.
And that's where the gaslighting kicks in, because he's trying to convince you that you're the problem too.
Exactly.
Yeah. So that's a good, kind of a good segue into, besides a change in the language that he used, what are some other signs that, you took hold of this thought, okay, he's working recovery and
I could see that he was less defensive. He was more open to hearing things that I had to say. And I had to work on not being angry all the time, because I really wanted to continue to be pissed off at him. And so, the turning point probably for me with that was Valentine's Day. And it was going to be Valentine's Day, and it was clear he was going to get me stuff. And so I kind of felt like I need to at least get a card. And so I'm in the Hallmark store, and it's all, my soulmate. I'm like, and I found myself in the middle of the aisle wanting to yell, "Where's the asshole section?" And that was really a turning point for me, to kind of realize, okay, I need to get a handle on my anger. And I can see he's making steps, and I really have to make some steps.
okay. Jim, do you have any insights into the relationship world from the side of the sex addict?
One comment that comes to me when you mention that right off the bat is there are times, in reading the steps and the essay and the SAA, it talks about how and when and how much should I share my story with my spouse? And I can't remember which one of the programs. It says, don't reveal anything to your spouse for the first 6 months. I would say, I guess, except you're getting help. And only after you've established a relationship with a sponsor, support group, and hopefully, people can afford a therapist. Although apparently people have gotten better with the 12 steps and with their sponsor. But it is a question of honesty. There's no two ways about it. And so I usually would say, if a sponsor asks me about it, I'll say, talk about it at your meetings, get feedback. And I would say only share what might be helpful for them, not for you to unload everything on them. And then, you walk away feeling good and they walk away feeling terrible. Yeah, and again, like I said, everybody's different. My wife, when I was married, and she had started going to COSA, and I said to her, how much would you like to know about my addiction? She said, I don't want to know anything. She says, you go, do your thing, and I'll do my thing, and go from there.
Mhm.
So there really was not much at all that I shared. So I think it's like each individual couple.
Yeah, a lot of women
Mhm.
want to know all they can know. And I think it's because it's they're just so shocked and so it's unusual that she did not.
Yeah.
I didn't. I learned plenty by going through the huge porn stash. And really, there are images that I would like to get out of my head. But yeah, that's unusual. Usually women want to know, and it doesn't make them feel better, generally speaking.
It seems like they hear the sharing, okay, they unloaded, and I think I wonder, you guys have known this better than me, is a woman is certainly caregiver, and wants to take care of. And, this is something different. And I would say if, again, if they're gonna want to know, I would suggest saying to them, why don't you find a therapist first or go to COSA meetings, but don't just let that stuff come on, because then it like they feel worse. They
Well,
really
this
do.
is a process that Patty and I were involved in. It's called disclosure and making full disclosure, but it's best not done right away.
Right.
But it's best done for people who have a foothold in recovery and then come together to do it, because otherwise it could be end up a disaster, because there's a lot of service like blaming and lack of understanding. This is an illness, this is a disease, treated. So.
Well, to know that it's not their fault.
Correct.
That is, to me, that's so important.
I never
Yeah.
felt it was my fault. I know it,
Mhm.
but that's not the case for a lot of people.
Yeah.
Another thing is for us to talk about is like, what is non-sex addiction?
Go for it.
Well,
I'm willing to listen.
Yes.
Transsexual
Mhm.
is not sex addiction. Being gay is not sex addiction.
Mhm.
Yeah, these are not these are this is determination through genetic or however, whatever it means, that where a person comes to become aware that this is what, this is their attractions to men, for a male, for me, say, or a female, and that they're woman caught in a man's body, those are things now. And of course, we see so much more. Of course, there's some fraught with all the controversy in the press and all like that, but it's still, it certainly needs a lot of understanding. And it's important for us as therapists to understand the difference, between this and these factors.
I do want to say that both COSA and the group that I've been a part of here, Meridian, we have had men in our group, and they came to the group kind of fearful that they were going to be judged, and did not find that the case.
Yeah. You talk about male partners.
Mhm.
It's, anyway, it's and the other, I just keep saying this over and over. This is trivial. The problem is that it's important to have a program like this. Hopefully, we can spread the word and let people know that the help's available. And it's sort of like to shout from rooftops. Let people know this is not a treatable illness. And but not only that, of course, the recoveries for us, Patty and I, witnessing recovery is so enormous, so special to see the transformation people take, and then out helping others.
Yes, that's it. Yeah. Yeah. We help ourselves by helping others.
Yeah.
Ask one more question, and then I'm going to ask one more question, and then we'll open up to the audience. And this is kind of, I think, for Dr. Bowen, what's the kind of talk about kind of the hereditary, or the fact that addictions can travel from generation to generation in a family, and maybe a little bit about, so what's a way in a family that has the addiction to try to not pass it along?
Dr. John Money at Johns Hopkins, he was head of the psychosexual disorder unit there. He's dead now, but in the mid-'80s, he published a book called Love Maps. And in that, he had studied the history. He cataloged all the different paraphilias. Paraphilia, for example, would be exhibitionism, voyeurism, voyeurism, they're different paraphilias. And he said that most of the people that have these paraphilias, they were imprinted on the brain when they were a child. I remember a man we had as a patient when he was about 8 years old. He's walking in the woods, and a naked man walks by. It's such powerful impact on. He became an exhibitionist. So that doesn't happen to everyone's exposed like that. But for so many people, the person I said for my first patient I saw, he had his problem was fracturism. His problem was using enemas in association with sexual repertoire. So that all started when he was growing up in New Hampshire, rural community, and his mother was probably schizophrenic, but for every problem he was punished with an enema. So it became the anus then became a sexual organ and became sensitized, and so then he becomes, in his adult life, he's not able to experience orgasm without the enema. So these are some examples of how this disease can begin in childhood.
Okay.
And more on that. Did you have more on that?
I was curious about because we see clients who have children.
Yeah.
Particularly, male client with sons, and how do I, or what do I do? How and when do I talk to my sons about this?
I think probably from age 6 months on. issue here, of course, one of the most damaging effects we see is pornography.
Mhm.
And exposure to pornography. So often that Dr. Money says that the love math is full of it, pretty well determined by age 8. The child who's exposed in those young ages can be overwhelmed
Mhm.
by it, and also it may play a role in their sexual life growing up. So, and this is omnipresent. It's every place it seems we have this pornography on the internet, print, and all that. So it's off there. It's a powerful trigger, I think, in child. So I think education starts early, and also makes sure that children should not be exposed to pornography.
Okay. All right, we're going to open it up to the.
I would say adults should not be exposed to.
Jay, you're
There you go. Okay, there's a question.
Just quick chat on something.
Let's see.
I have a question.
Okay, go ahead, Scott.
Why is it that we don't hear about sex addiction in general conversations? And I'll give you an example of what I'm talking about, because it happened to me probably 6 weeks ago at church. We have a lady that was giving a little speech about a missions thing she has going on with children overseas and training counselors and stuff for them, and all about drug addiction and alcohol addiction and child trafficking and all this. And she's a drug and alcohol counselor herself. And I keep waiting. I'm just, okay, where's sex addiction? How come we're not talking about that too? And I asked her that afterwards. I says, I'm a recovering sex addict. I'm a recovering alcoholic too. I've been sober from alcohol since 1979. And I told her, I said, why don't people say this? Why isn't it talked about? And I say it jokingly sometimes, but I really feel this. But had I known in 1979 about sex addiction, maybe things wouldn't have gone as far as they did. And I think that's something for me personal that needs to be brought out into the public. Because child trafficking, I would be willing to bet that 80% of that is because of sex addiction somewhere in the line. And if there's any way I can help, let me know.
I think we have a problem with it's a good question. One of the problems is that sex addiction is not included in the DSM-5, which is the diagnostic list for all the diseases. They have exhibitions of voyeurism and things like that, but for sex addiction. And what's happened is there's another code book called ICD-9 11, and that has recently included sexual compulsion. Mm-hmm. So we have a problem with in the counseling world, I guess, is not able to come to grips with the term of sex addiction. Now, this book is the Sex Addicts Anonymous. Mm-hmm. So this is now for me, addiction, tolerance, dependence, sensitization. These characteristics are the same for this compulsion mm-hmm. as it is for alcohol. So I don't have any trouble with this, but the problem is that we haven't gotten the scientific community on board to acknowledge the term sex mm-hmm. addiction. And
well, and I think the significance of that is without it being in the diagnostic manual, health insurances typically will not cover the treatment for it. There has to be another underlying condition that the insurance companies are willing to pay for.
So just jumping in, do you also have a normalizing of or an expectation that these are sort of normalized behavior, sex, food, gambling,
Yes.
are all normalized behaviors in day-to-day culture,
Mhm.
whereas heroin and meth is not.
Is-
And so there's this sort of stigma that exists, I would assume, that this can't be an addiction because we have to do this, just like food addicts
Mhm.
wrestle with the fact that they have a food addiction and nobody looks at it as that
Mhm.
they almost scoff at it. How dare you have a sex addiction? This is natural for procreation. And so,
Yeah, and I think that's interesting because the gambling addiction is now recognized in DSM-5. If you look at that criteria and you substitute sex for gambling, you can equate everything. It all, you know, it's the same thing. You know, so I agree that the scientific community needs to come along on that, and
Well, that's all written. It's just
Yeah.
all.
yeah.
it opens a lot of doors to
Yes, it
this
does.
sort of perspective that a lot of these disorders have.
Yes.
A lot of the community has, the opinions that exist, but then it's up to those that are walking this out to really combat that and go, yes, and that I'm thankful that you guys were willing to do this because this is a step in that direction.
And I would, as I said, the church that I'm affiliated with, we looked very seriously at trying to host a sex addiction group for high school students. But because of the fact that we were dealing with minors, the all the requirements by SAA, which were important, it was just more than we were going to be able to accomplish. And so it's a challenge, because sex addiction is really a huge problem in high school and middle schools.
Okay, looking at the chat box, let's talk a little bit about the materials that are more details about sex addiction, how it's resolved and treated, and kind of what kind of timeline and commitment might be involved. Well, and I mean, I think we have Jim here who's 35 years sober. 35 years. So, you know, I'm not sure at what point you say, you know, I don't know you're ever completely over the treatment process. It is a change in the way that you go about your life and the way you live your life.
Only the first step has to do with addiction. They use the word addiction.
Yeah.
But all the rest have to do with your life and healing the losses that you created. So for me, I go narrow meetings. I'm working on those. I keep working. So you'll never admit it. Now, one of the things you're probably referring to is when is the danger over? When does that? And I think that's a process that takes time. I know Jeanette was commenting a little bit on that, you know, as she told her story. So it takes time to do that in patience. But what we look for, I guess, is no acting out, you know, and healthy sex and relationship. Now, the no acting out starts first. The healthy sex relationship comes a bit later. But it has to do with, you know, partners kind of coming together to develop a healthy sex life. But meanwhile, continuing to work the steps and it's a matter of self-awareness. It doesn't happen overnight. I watch people who've been in groups and they'll say, oh, that's how it is. Maybe they're in group 6 months or a year. They say, oh, that's, you know, all of a sudden it hits them, you know.
I'd like to make a statement to that. My name's Cliff. I've been in the program 22 years and two different directions. One, I'm a firm believer, and I started out with Patty as I had an intervention with alcohol, and then I've been with Dr. Bowen for the rest of that time until he retired, and I'm back with Patty and our group here. So it's 22 years here in this office. And I've come to the conclusion that, yes, I had a problem as a sex addict and still have a problem as a sex addict. And I'd just like to say and bring this up because it does affect, and I'm sorry to Dr. Bowen's right. Your name is to your
Jim.
left.
Jim.
Your left. I know Jim. To your left. Yes, your name? Okay. My relationship with my wife has been very, very difficult for her because of my addiction. It's gotten much, much better, and we're very, very happy. But I have had a slip in the past 2 months. I'm a firm believer that one has to unravel one's past. That takes a lot of work and a lot of help from a whole lot of people to bring that to fruition, and the unraveling to get the insurance companies to do that. I'm a Vietnam vet, so we can call it PTSD, whatever you want to call it, but it is a trauma. There is a basis of trauma at the beginning of one's life that turns into different things. Mine happened to turn into alcohol, and for different reasons, and also for a sex addiction, because to me it was safe and I didn't think anything was wrong with it. And it did affect, even though I was engaged and married and so on, I just never stopped all through Vietnam. It was a release for me. Never did I understand until I got here with Dr. Bowen and Patty that I really had a problem. And I think that the trauma, PTSD, if you want to, whatever name you want to put on it, comes from the beginning of how you were treated. It has to be unraveled. And it takes a lot of help from the outside for one to start to begin to recognize the problems that the choices that we have made as we've journeyed through our life. I'm 75 years old. So there was a whole lot of unraveling, and even today is going back through that period of time in 75 years and say, well, I've been doing that forever. So, what's wrong with it? Well, there's a lot wrong with it. And you happen to bring up your situation with your spouse. Well, I never realized that. And even my wife just had her 75th birthday. And my daughter said to me, because this is the kind of thing that comes out. My daughter, I was dropping her off. She came in from Texas to be there. My son came in from California to be here for my wife's birthday. And we had a very nice birthday and so on and so forth. I was dropping my daughter off and she said, Daddy, I have never, ever heard anyone talk to anybody the way you talk to Mom. I said, what? My wife has said this from time to time. I don't do it all the time, but I do have a habit, because maybe you can pick up on it, but I sort of talk sort of like, are you angry at somebody? Kind of thing. But it made me realize that I still have a long way to go. And this last slip that I've had over about 2 months really hurt my wife. And I feel remorseful. I used to think that it wasn't me. I used to think that she was just making this up and everybody does this and don't worry about it. That's not the case. So I'm still, after 22 years, and you can ask Dr. Bowen and Patty, I've come a long way. I mean, I have come like, I'm a different person now, even though I talk this way, but I mean, that's how that is. Yeah. People that know me understand, but anyway, I think that it's a trauma. And we have to undo that trauma. We have, in order to realize the nuances of what our trauma came from and what it was, and to forgive it, or you can't make it go away because it happened, but you have to understand it. And in understanding it, then you can take the next step. The 12 steps within this and the promises and all of those things are so, I don't think you could rewrite them in a better way. That's how I have to live my life. I have to do that constantly. At first, just going to my first SAA meeting on Fridays, it was difficult. I said, well, I'm going to go and I'll listen, and you hear people saying, oh, that's not me. I didn't do that. But as you start to stay, you start to realize, you put that into your own context and you start to unravel. And it's difficult. It's very, very difficult at the beginning. But as you go on in time, to have my daughter say this now at 75, it really was an eye opener. I mean, my kids were very open in the family, and someone, they can say what they need to me, tell me I'm wrong, and so on. That didn't happen when they were growing up. But we had a very loving family. I didn't do what my parents had done, and I came from a very good family. But I just wanted to mention that it's a trauma, and it has to be unraveled, and it has to be unraveled by each and every individual in their own way. But it has to be unraveled. And that's the only way you can look at the progress as you look back. I remember, Doc, you and I were talking one time when I came back from Keystone. And I said, I'm not a religious person. My wife is devout Catholic. I'm not very religious, but nature is my God. As I look, and that's my response that I get when I look at the ducks in the lake and the ocean and so on and so forth, the trees and the woods. So that speaks to me. And that gives me the reverence that I need to have for myself and my soul. So I just wanted to say that, because it's difficult for us who have gone through recovery for such a long time not to say, why isn't something being done about this? But maybe the approach could be a PTSD kind of thing, where it's treated as a trauma, just like other mental problems or alcoholism or whatever. It all, like I think one of you said, that it's all the same thing. It has to be unraveled, and it comes from that basic trauma.
Okay.
Thanks for letting me talk.
Thank you, Cliff. I wanted to move on. There was a question about how attachment disorders relate to sex addiction, and
well, attachment disorders, we call sometimes sex addiction a problem of attachment and problem of intimacy and ability to deal with feelings. Attachment is what happens to us when you're born. In most cases, as an infant, you're given to your mother, and she nurtures you, she loves you, she takes care of you. And that is the attachment. And if the mother is, anyway, you're a good mother, she's going to provide that for the child as the child grows. They will have an understanding of connection and love and intimacy. When that does not happen for whatever reason, the child suffers from that attachment problem of not knowing or being comfortable with attachment. And there are four styles. And there's only one good one, that's secure. And there are too many people that have that attachment style. But it's fascinating, and it's interesting, and it's another piece to a puzzle of all of this that we work on, as far as issues that the sex addict often hasn't been taught or learned at home.
that's, yeah. Okay.
I had a barometer. My father and I had a conversation when I was in high school. I came from a family where there was no alcohol, and that was driven by my mother. And, you know, one sip, you're an alcoholic. And my father did not come from that kind of environment. And so one time when we were alone, I said to him, why you drink when you're around your family, why don't you drink other times? And he said, it is important to your mother that I don't drink. And because it's important to her, it's important to me. And if something is more important than the people you love, then you have a problem. And so that really has been a barometer, and really just before things exploded and our relationship, I was taking steps to leave because it was clear that that I and my children were no longer good.
It's a good barometer.
Between yourself and Cliff, I like to phrase it a little bit of a different way. My addiction becomes my number one love handle. And without that love handle, nothing else means anything. And in fact, so much, I believe so much so that whatever gets in the way of whatever addiction it is, including sex addiction, is going to get somewhere along the line is going to get shoved to the side because I can't live without this.
Right.
Yeah.
Even though whether it's alcohol, drugs, food, sex, it's ultimately going to kill us in the end if we don't finally say, you know, uncle. And to me, that involves a grieving process. I need to grieve the loss of that love object that I had. Grieve it because it was doing something for me. But again, more and more, it'll kill me if I keep on going down that road. And it means grieving that, however long it takes. Everybody's different, however long it takes. And then it's not just with the addiction, but like I said, the 12 steps can become a way of life for the person. And it never stops till the day I die. And I know I wanted to say this, till the day I die, that addiction is going to be a part of me, but it doesn't have to control me.
Okay. I think we have time for one more. There are a couple questions in the chat box related to confronting a partner, or there's one that, you know, within SAA or as a sex addict, how would you confront another sex addict that you knew who wasn't in good recovery? And I didn't know if there were any thoughts on there about either from the standpoint of confronting a spouse or somebody in the program. Or Doc, for you as somebody's counselor.
Well, I can't speak for being an SA member and how you would handle that if you see somebody. It's one of the things that one of the recovery things that I work on too. Is not to give advice, I must ask. So oftentimes I don't want to step in and try to fix someone who really doesn't. If they want to come and say, ask me, then fine,
okay.
I'd be get involved. But otherwise, I wouldn't go and try to fix that.
Jim,
What I would say is, if the person is in enough pain, and it's some kind of recognition, you know, with that, maybe then they want to kill themselves, or their acting out gets even worse. but they gotta be in enough emotional, physical pain, and since I believe it's a spiritual program, enough spiritual pain. Because for the addict, their drug is their spirituality. And to change that, they need to work through, die to that spirituality that's killing them and develop a healthy spirituality that involves the relationships and the help and all the other stuff going on. And they have to be ready because there are people that say, would you please talk to so-and-so? And I did, and after half an hour, I say, when you're ready, let me know. So long.
I like the 10th step. Continue to take personal inventory, remember long, not be admitted.
Okay. Jeanette, do you have any perspective on that?
I'm guilty of trapping. I'm really good at it. Once one of my boundaries was, if you slip, you need to tell me within 24 hours. And then we'll work towards what we need to work towards, but, and if I have found something, I collect evidence, and then I present it in such a way that you're stuck. So, probably not the best way, but
Okay.
it works in our household.
Okay.
Usually it's kind of like, yeah.
Yeah.
Okay.
I have a comment following up on something that Jim said, talking about the connectedness or the relationships. One of my favorite recovery quotes is, the opposite of addiction is not sobriety, it's connectedness. And I think that's I think that's where the power of SAA comes from. I think that's where the power of the groups come from, whether it's a group therapy setting or COSA or SAA, one of those organizations.
You did make pops. To me, it's about the relationships.
Yes.
The programs are about people and their relationships with each other. There's the material, but it's got to, wind up within the person to be. So to me, it's a program about relationships. And you can't do it by yourself.
Which
You
is
tried it.
Which is what spirituality is.
Everybody tries it.
Yeah. I think I just asked, does anyone on the Zoom have a burning question or something we didn't quite get to? I tried to get to everything that I saw in the chat box, but anybody on Zoom have anything? Yes, Carla?
Hi, everybody. How we doing?
Doing good. How you doing?
I'm doing well. So you kind of touched on it earlier as far as it being inherited. Is there evidence behind that in the medical field?
Well, that's the work of Dr. John Money. Now, this is not an absolute. It doesn't mean just because you're exposed to pornography, you necessarily will become a sex addict. But in some people, it can result in distorted sexual life. Where you're more focused, like exhibitionism. Whereby that's your primary way of sexual expression, and sometimes that can come from some childhood exposure. And when we're doing an assessment, we sure want to try to go through the person's history in great detail to find out what their childhood was like,
Yeah.
And as Cliff was talking about earlier about the trauma, so we almost most everyone who's had some sort of trauma we'll be looking at. But so what you were saying that it's not an absolute, but it can be possible that if you're exposed to sex prematurely, like at an age before age 8, you can end up having sexual compulsion in later life.
And there is evidence, there's medical evidence or medical might not be the right word, but there is evidence that addictions can travel through families. You know, I know that one of the things that happens early in treatment is doing a family addiction tree. I mean, are there other people in your family who have addictions? And and I think, the way I look at it is, it might not be hereditary as in related to your genes, but it's definitely related to how you are raised and the kind of communication that existed in your family. If you have an alcoholic in the family and nobody talks about it, that can be extremely damaging, because most of the people in the family realize it at some point. And it's part of the not dealing with the situation, not talking about it openly and honestly, that I think keeps a shame cycle going, so that this is something we just don't talk about. And so if we don't talk about it, we don't deal with it.
I think if you are a girl who has been molested,
Mhm.
it very much affects how you interpret relationships,
Mhm.
or how you seek them out.
Well, with me, we're going into 4 generations, starting with my dad, me, my sister, and my daughter with this addiction. So that's why I asked, was it hereditary?
There's also
Yeah.
some experiments been done with the families, like in Sweden, where they took children who come from addicted home. Then they were adopted into another home, not
Mhm.
alcoholic, but still their incidence of alcoholism is fairly high.
Okay,
So it starts a child.
okay.
All
All right.
Some thoughts, and just last thing, just to hear kind of last thoughts from you guys, but then also, where do we go from here? Because it was a great discussion, but then where do we go from here?
I think we need to have this weekly, honestly. I'm serious though. I'm dead serious.
No, I think this should be again. Yeah.
Definitely. So Salo, get on your
All right,
business.
John, put that on your list.
Yes, sir.
You too, Salo.
This will be on our YouTube channel, on the Meridian Psychotherapy Services YouTube channel. Share it, share it with people that need it, get the word out, get it. And if there's enough of an interest to be able to do a follow-up conversation, we're never opposed to that at all. I think that this was more than healthy and more than necessary. But what else could we do? What are the takeaways?
It's not every place that's a safe place to talk about it.
Yeah.
Well, other than the meetings, the SAA meetings and so on that are out there daily, this type of forum, this is the first one that I've seen. So other than our private groups that we had here at Meridian, this is the first little forum that I've seen. And Patty, if you can set that, John, set that up, Doc, set that up. I know you're in retirement, but come on back, Hey. You can make it once a month. I mean, that'd be good to start.
John, I'm working with EVMS to do programs for doctors and all that.
Oh, wow.
And I think that's part of it. I think, if there's something that can happen to have it recognized by the next DSM. Dr. Bowen gave me a book, Dopamine Nation. And it talks about the way, when they look at drugs and decide how addictive is a drug, they look at how much more dopamine does it release.
Yeah.
Well, sex releases dopamine and it creates that same cycle. And maybe if there's some way to, push that and not have it be, it's, you know, it's called sex addiction, but it's that the hijacking of the dopamine system.
One thing we didn't talk about is sex offenders treatment.
Yes,
There's sex offender treatment, which is mandated by the state.
which,
Now, that treatment doesn't involve 12 steps. That treatment is more control, whereas
Yeah.
your sex addiction recovery is surrender. It's giving up, trying to do everything that will help you.
Yeah.
And this is there's many sex offenders, many more sex offenders therapists than there are sex addiction therapists. It's a long way to go, I guess,
Yeah.
to try.
I think part of the encouragement is that for everyone who is not just presenting here, but everyone who's active in this community in some way, shape, or form, that you advocate. And there's different roles to advocating, and there's different ways that you can advocate. But that one thing you do is that you normalize this part of the conversation as well within your own circles.
yes.
And we do this as, you know, as an encouragement to say, look, there's this stigmatization that happens with all addiction, but there's a need to normalize conversations. And so while we work to do the lobbying, while we work to do this online and make these forums more and more frequent, we also have the day-to-day work that we have to advocate for this population to say, look, this is a normal conversation that we need to have on a regular basis. And I think that each one of us carries a different level of responsibility, and it's up to the individual to kind of figure out what that responsibility is.
I think in some cases, we have to get to a point of being mature about talking about sex. Because to me, our country's adolescent, they giggle, laugh, or they don't talk about it at all. And that's not going to get us anywhere. We have to talk about it, period.
Yeah. Definitely. So help us help you.
Okay.